Hi, this is Teal,
And Grace.
and we're here to talk to you about our health disparity project. It's about access to reproductive health services. I'm going to start by talking about Title X, the new gag rule, and end with a story that highlights the type of issue that will arise for patients and providers alike.
And I will be talking about the consequences of the gag rule in regards to nursing, more specifically about the nursing process, patient education, and being an advocate.
So data in the 60s showed that women, especially low-income women, were having more children than they wanted to have. Research also showed that pregnancies close together in earlier late reproductive years tended to have negative health impacts on mothers and children. Other research at the time also showed evidence that teen moms who hadn't intended on becoming pregnant had increased poverty rates and dependency on public assistance. This also impacted women's ability to be part of the workforce or just to complete their education. It became clear that improved access to contraception would further the two vital social goals, reducing poverty and improving the health of women and children. Congress created Title X, a family planning program in 1970. It was called Title X of the Public Health Service Act. Title X is the only federal grant program that works to provide people with comprehensive family planning and related screenings and preventative health care services. Title X requires that patients seeking services for contraception must also be offered related preventative health services. The program's official guidelines specify that services must be delivered. What services must be delivered. These include checking blood pressure, breast exams, pelvic exams, Pap tests, STI, and HIV screening as well. Title X does not allow for the program funding to pay for abortion, but it does require that pregnant people must be offered information and counseling on all options available. This includes prenatal care and delivery, infant care, foster care, adoption, and pregnancy termination and referrals. For people facing an unintended pregnancy, non-directive counseling gives just the facts about all the choices in a neutral manner. Pregnant people then are able to look into options and decide what would be best for them and their needs. On August 19, 2019, all Title X grantees were required to certify their good faith intent to comply with the Trump administration's gag rule. This has forced providers to either give up needed financial resources or their patients' right to unbiased and complete information, counseling, and referrals. All Planned Parenthood affiliates have officially withdrawn from the federal Title X program. This may cause people seeking long wait times, or the need to travel great distances for care, or being unable to even obtain care. So I'm going to tell you a quick story that shows the ethical dilemma that was caused by the gag rule of Title X funded facilities and how care is impacted when comprehensive conversations can't be had. One physician working on the west side of Chicago at a family planning healthcare center cared primarily for patients who lacked insurance. She saw firsthand what it meant for people to have access to both preventative care and providers who were able to counsel them effectively, and what it meant when they didn't. Her story is about one patient in particular. She was in her late 30s and uninsured. She came to the clinic with an unintended pregnancy. She had been told inaccurately that because of a medical condition, no method of hormonal birth control was safe. So she relied on condoms alone. In other words, she had received the kind of misinformation that Title X funded clinics can help to combat. The patient also had a history of heart disease. She knew that for her, a pregnancy presented significant health risks. At the Westside Clinic, the physician was able to counsel this patient on all of her options. These included continuing her pregnancy with dedicated care to address her cardiac risk and abortion. After careful consideration, she opted for abortion, and the physician was able to help her obtain one. Because of Title X funding, afterwards, she was able to get a safe, effective method of contraception. The availability of these options and the ability to obtain care provided this woman with the autonomy to make informed decisions that was best for her. A ban that prevents counseling and comprehensive, well-informed care would be against the provider's oath to do no harm.
So as I'm sure we're all acutely aware of, nursing is a complex field to work in. For managing the required daily tasks in order to provide comprehensive patient-centered care and remaining competent in both skills and knowledge, all while still remembering at the end of the day you need to take care of yourself and your own mental, physical, and emotional health, there's a lot to juggle. That being said, there at times are obstacles that interfere with the nurse's ability to provide that comprehensive patient-centered care. A significant component of nursing care is the nursing process, better known as ADPI. The purpose of the nursing process is to allow nursing professionals to identify potential problems and create an informed plan with the patient in order to reach solutions. Therefore, with the institution of the Title X gag rule, a nurse working at a reproductive health facility becomes limited in the actions and information they can actually provide to a patient, influencing the nursing process. For example, if a patient presents wanting to know more about what their options are in regards to birth control, the nursing diagnosis would be knowledge deficit, yet with the institution of the Title X gag rule, there would be limits on the information that can be provided, therefore also limiting the interventions that could be implemented. When it comes to reproductive health, the nurse must work to create a conversation that helps the patient to think about what options will work best with their lifestyle. Examples of these questions that help to create this narrative include, do you plan on having children? When would you want to have children? And what can I do to help you achieve your plan? Questions that really stress the importance of the patient's voice when it comes to creating a plan by encouraging that thoughtful, well-informed decision-making. Often healthcare decisions, and especially reproductive healthcare decisions, can be ill-informed. With the internet and the lack of sex education in some schools, people may not realize the choice that they do have when it comes to reproductive health, thus stressing the importance of that conversation. There really needs to be an open, honest, fact-based conversation where all options are laid out. If this is not allowed, then the individual really is not able to make their own decisions. In a way, it has been made for them by the government. It is blocking the nurses from discussing a full range of options. You wouldn't limit what options the provider was able to discuss with a patient who had diabetes or renal failure. By limiting the nurse's ability to educate and provide informed resources to the patient, the Title X gag rule is taking away patients' options. What all this really points to is the importance of advocacy in nursing. Of course, there is the everyday advocacy associated with nursing, such as checking for errors or oversights and orders, connecting patients to appropriate resources or individuals, or even simply patient education. There are also ways for nurses to take their concerns outside of the workplace. As stated prior, the Title X gag rule is working to limit the information and services reproductive health care facilities can provide patients. This unproportionately affects women of low socioeconomic status. In some states, there can be very limited access to any sort of reproductive health care center. So even if a person was able to access one of these centers, providers would not be able to provide that care the patient was really seeking. The ANA states that advocacy is one of the pillars of nursing and works to boost the voice of nurses on Capitol Hill. There are a multitude of ways nurses can work to make their voices heard in legislation, from writing to local and state government officials, to becoming involved in local groups such as city councils, or even if they wish, potentially running for office, there are options to make your voice heard. Even simply going out and voting is one way. It is easy to become frustrated by legislation's impact on healthcare, but it is important to remember to make your frustrations heard. If nothing is said, nothing will change. So in conclusion, choice is an important factor when it comes to providing comprehensive and efficient patient-centered care. In order for a patient to make an informed decision, patient education needs to take place between the nurse and the individual. Legislation like the Title X gag rule becomes an obstacle when it comes to providing that education, affecting the patient's ability to make their own decisions. It is important for the nurse to remain an advocate both inside and outside of the workplace in order to allow for options, not obstacles.